Well, good morning, good morning, good morning. Dr. Peter Holst here with our Wednesday morning, October 2nd version of our Facebook Live. And here we're talking about today, I would like to talk about the relationship between our spine and our nervous system. And sadly, I don't talk about this enough, but it's very powerful and something that needs to be said every now and again. So today's the day. So it's a wonderful day in the neighborhood. So this is the progression. This is my standard model of spinal degeneration. This one is textbook normal. Nice plump vertebrae discs, good shape in the vertebrae, no slipping, no spurring. In the back part, the facet joints are clean and clear, no degeneration in those posterior joints in the spine. So this is again what they would call textbook normal. The nerve that comes out between the vertebrae is nice and plump and conveying information. So that's textbook normal. When we start to get some stress and pressure on our spine and our vertebrae, we go to phase one degeneration. This is phase one degeneration where the disc starts to desiccate, starts to get some cracks in it and fissures. We start to get some blood infused into the central part, the propulsus of the disc. And that's phase one. Maybe a little bit of atrophy on the nerves, but pretty much just the beginning of disc degeneration right there, phase one. Phase two, if left uncorrected, will progress to phase two. This is where we start to get some good old-fashioned lipping and spurring. This is decades old, this degeneration. Notice the disc itself, it's cracked and just about ready to bulge out there and squirt its lovely content into the surrounding area. Notice also in this view that the posterior facets, these very pain-sensitive joints, are also experiencing some arthritic changes. And perhaps the biggest thing to notice is the bulge right here. You can see that bulge coming out. How can I hold this so you can see it? And notice the nerve. The nerve is starting to atrophy. And this is consistent with the work of Dr. Sue. I think the University of Washington back in the 70s discovered that the pressure from the weight of a dime, if left on a nerve for more than 3 minutes, will reduce how that nerve communicates by up to 60%. Pretty significant considering these nerves just don't experience pain. They also go to our vital organs and they get a nerve supply as well. So this is phase two, spinal degeneration. Again, left uncorrected, it will proceed to and progress to phase three. This is pretty significant and serious degeneration. The disc is practically all gone. There was at one time a nerve that sat in here. Unfortunately, it was so atrophied that it kind of withered away and somehow got lost in the shuffle. I've had this model for several years, but again, real bad degeneration of the posterior facets, and the whole thing is just too far gone for me to help, that's for sure. Which is the point, that we want to get patients as soon or at textbook normal as possible. This phase one takes years to progress. I've seen this in young people, but here's the sad part. I've seen this in young people too. What does it take to not get this? Well, it'll take some diligence and some effort and some chiropractic adjustments. Core strength is vitally important. Go to our YouTube page and check out our information on core strength. I know I sound like a broken record when I talk about core strength, but it's important. It holds you up. It supports your spine. It provides support, guidance. It's a first line of defense to any injuries that you might have or might experience. But I wanted to get back to this part here, this atrophy of the nerve, that part that I mentioned, the weight of a dime reduces how that nerve functions. We also have in the office, and I know you're not going to be able to read it because of the mirror script deal, but this is our nerve chart that reviews the different areas of the spine where the nerves go to and what they affect. And here at T7, it says spleen and immune function. So what that means is that nerve interference at C7 you could expect to see a lowered resistance, immune deficiencies, frequent colds and flus. Sounding familiar, sound like something we want to talk about here and consider. It's not uncommon for a patient to come to me and in the middle of their care, in the beginning of their care, say something to the effect, you know what, Doc, I didn't get any colds this year, and I normally get at least 1 or 2 colds. We went through the cold season, we went through the flu season, I didn't get sick. Why is that? And I simply point that out to them, that we're providing better function for your spine, but better just as important, perhaps more important, we're providing better function for the nerves that communicate within your body. So there's a reason why I say that we provide better health naturally. We provide solutions for better health naturally. So that's my message for today. Your spine is more than just creating pain for you. It's also impacting your nervous system. So again, colds and flus, we see a reduction of asthma. Patients oftentimes have fewer bouts or less bouts or no bouts with asthma. There's all kinds of things. How about indigestion? Some patients will say, you know what, I don't have to take my Tums anymore. So if you're experiencing any of those things and you're tired of taking those drugs and you want to explore an alternative way to help with that, give us a call and we'll see if we can do a nerve scan on you and see where your nerve interference lies. If you do have any structural problems, the back part of this is a nerve scan of somebody that's perfectly normal. So if we see any red or greens or blues in that scan, we would know that there's nerve interference going on. That's my message today. Maybe I'll explore a little bit more of this nerve interference stuff. We'll go through more of this in the upcoming episodes. In the meantime, it's Friday. You're going to have yourself an awesome weekend. I'm going down to Pennsylvania tomorrow. Hopefully I'll be able to see my grandson Caleb. It's looking like it's possible that he might be released from the hospital on Sunday. So I may see him before I have to head back home. So that's it. Out of here. I just wanted to acknowledge Amy. Amy's been watching with us. Thank you, Amy. I appreciate you for doing that. We got a couple other watchers, but I don't see any names here. I'm still getting used to this iPad. Anybody have an iPad that does these kind of calls, these kind of Facebook Lives? Let me know how it works. Okay. Right now I'm just winging it. Okay. Have a great day. Good weekend. And we'll see you on Monday morning. Take care now.